Okay, hello, good morning, good afternoon for everyone. Welcome to this webinar. This webinar will try to explain the mechanism of action of a novel product, novel at least in the management of the fat tissue, overall in the facial fat tissue. Um, I would like to introduce myself. Okay, I'm a plastic surgeon, graduated in Buenos Aires, Argentina, in 1996. I had the degree of a plastic surgeon. If you notice, this year, in 1996, uh, this was the age of botulinum toxin came to my country. So I graduate as a knife guy, and I had to move to a needle guy. So it was a lot of work in my mind to adapt myself to mini invasive treatments. So I fell in love with the mini invasive treatments. So I became a speaker of many of laboratories, and I began to make fillers and botulinum toxins since those ages. And then we added some different devices, uh, energy-based devices, to improve this process of aging. This process of aging, if I have to explain, I will go again. Look at this. Until the 40s, we didn't notice any great changes, but after 40s, the aging process commenced to show up. And I would like to divide it in two stages, in two moments. The very first moment is the deflation of the soft tissues, and then is the sagging. So this process could guide us to offer the patient the best treatment or the best treatments, multiple treatments, in order to attack all different targets. So to reverse this process, we are obliged to add volume, the lost volume, and to produce more titin in the skin and improve the skin quality, sunspots and whatever. But there wasn't still remaining things not to make it clear and to get the solution. So we have to notice that since 2007, in which Joel Pesa and Rod Roddick discovered the fat pads, we discovered that these fat pads in the lateral aspect of the face dissolves and diminish with the time, but not happen this same process with the frontal aspect of the face. So these three fat pads that I'm showing, they are diminishing compared to the other ones that is very proof that not only not diminish, but also can improve and can enhance and can make an augmentation of these fat pads. This is the reason in which during decades it was a real headache in order to disguise this kind of fat pads. So when we receive a typical patient with some spots, with skin quality not so good, and with the deflation and with the sagging, we were aimed to treat, moreover, the lateral aspect of the face. This is a cadaver in which shows all the ligamentary line, and we can see the fat tissue and the rear part and the rear aspect of the face. So all our efforts were conducted to give supports, to treat the amount of skin, to produce a shrinking, to treat the skin, and also to restore and reposition the fat tissue, the bony tissue, okay, with fillers. So this was our classical strategy, by giving fillers and by giving biostimulators, and to get this result, of course, adding IPL. This is a good result, but it is still remain this fat tissue. That's why we went to Verona, Italy, with my team to see Dr. Pier Paolo Rovati, and he showed us one energy-based device, which is Morpheus and FaceTite and BodyTite. And we could see him in action, performing techniques with this very good device. And after the procedure, the practical procedure, he taught us about many of his own techniques. And he shows up pre and post. And I could see that FaceTite could improve the double chin, the neck, produce the tightening. But what about this? So I asked him, because this area is a little bit dangerous, because you could damage the branches, the marginal branches of the facial nerve. So I asked him about the parameters in which he used to treat the jaw. And he said to me, no, I'm not using anymore the jaw. And I said to him, okay, but this is improved. And this jaw almost disappeared. What happened with this area? Okay, I am using a liquid to remove this fat pad. When I asked him, he said to me that it was a liquid to treat this fat tissue. And this is our target. You can see the fat tissue distributed in lobules to give support, and also to give storage to the skin. He taught us about all the line of Cellbooster, and I realized that there was a very good tool to help us and to improve the jaw by disappearing, or almost disappear, at least diminishing. And he taught me about the Cellbooster Shape. He gave me the indications, and I Googled and I found research, tried to find researching about the Cellbooster Shape. It surprised me because it was a very novel product, and it promised me to be at least safe, because his components are HA, non-cross-linking HA, L-carnitine, and vitamin C. These are natural products and safe products. The L-carnitine is added to this product to produce, to improve the fat metabolism and drainage, lymphatic drainage, and the vitamin C for both, and indirect pathway to correct the excess of fat tissue, and also to collagen remodeling. The mechanism of action is for the L-carnitine. You can see this is the cell membrane, and when you add the Cellbooster Shape into the fat tissue, the L-carnitine allows the fatty acid to enter, because of a chemical action in transforming the fatty acid acyl coenzyme A to acylcarnitine plus coenzyme A, and enter to the mitochondria and produce beta oxidation. And this beta oxidation is transformed in energy. So the main issue of the of the product is the L-carnitine, who allows the fat vacuole inside the adipocyte to enter in its mitochondria to produce oxidation and free the energy. The fatty acid metabolism keeps me my attention because I think this was a main issue in which I see the effects so evident. But I suppose that it will take a time to complete this procedure. Regarding the fat tissue, the layer 2 of the fat tissue, we can have to know that there's two kinds of fat tissue in the layer 2 in the fat in the face. We have two kinds of adipocyte cells. One, remember that this picture, one is stuck to the dermis, which is the D-Wat, is the dermal white adipose tissue, which has another function in the face, which is combining the nexus and produce the link between the underlying fat tissue and the skin. It's more active, the cells are smaller, and it has a very small vacuole of fatty acid. So it's not for storage and it's not for giving volume. It's more functional. But the underlying layer, which is the S-Wat, this is our target in order to make a very good treatment. What can I say with this? That when we are injecting Cellbooster Shape, we have to enter at least 2, 3, 4 millimeters below the skin in order to attack the S-Wat, not the D-Wat. This is very important issue, and it has an explanation. The storage is due to the S-Wat, not to the D-Wat. Of course, there's a lack of evidence in injectable fat reduction products. So I decided to begin my experience in Argentina, following the indications of Pier Paolo Robati with needle. He taught me to introduce around 1 cc in each area, and I decided to inject 1.5 because 1.5 cc is the half of the vial. The vial contains 3 cc's in total. After the injection in the subcutaneous layer, I decided to make a massage. Almost immediately, we can see the first results, and we can see the diminishing volume compare one side to the other. This is a vector analysis in which it shows the vector, and you can see how the vector produces or indicates the elevation because the lack of the weight in the jawline. So I decided to make a comparison because the patient noticed, and I decided to study, and I could find the improvement of the jawline by diminishing the inferior jaw. Then later, I decided to use the cannula and see what happened. It's not necessary to put a thicker cannula. With this is 27G, so with 27G is more than enough because the liquid is not thick. So you can inject through the 27G cannula and make a fanning technique with cannula. about 5 millimeters below the skin. After the injection, we always have to make a massage in order to distribute the product evenly for all the surrounding area. The results were very good, but I'm science-based physician, so I decided to make my own study. So I decided to go to an operating room and with the patient who was undergoing to abdominoplasty, and I decided to take 3 samples. In the midline of the abdomen, I take around 1 cc of fat tissue as a sample, as a witness, and I inject on both flanks 1 cc of Cellbooster Shape. After 5 minutes, I remove and I took a biopsy. After 5 minutes on one side, and I decide to wait 10 more minutes. So after 15 minutes, I remove on the other side and take the biopsy. Macroscopically, I could notice that the fat has changed. I send it to the pathologist, and this is in Spanish. I will leave this slide for 10 more seconds in order to watch all the Spanish-spoken people to see what happened, and then it's in English. In the baseline, skin section with subcutaneous cellular tissue, nothing special, but 5 minutes after, it began to present small areas of fat necrosis and microcyst formation at the hypodermal level, but no inflammatory changes, no inflammatory cells. After 15 minutes, same thing. At the left, you can see the normal tissue, the normal fat tissue, and 15 minutes after, we can see the microcyst and no inflammation cells in surrounding areas. So I decide to move to the face. And a patient of mine who was about to undergo a facelift, I will cut all around the ear. So I decide to inject in the earlobe, in the left earlobe, 1 cc of Cellbooster Shape. And on the other side, the right earlobe, I decide to take it as a sample. And also I inject in the submental area, all areas that I will remove and I will treat with surgical procedure. So it was very easy for me to take the sample and send it to the biopsy. Look at the layer, which is around 5 millimeters below the skin. And I inject 1 cc in the submental area. This is the sample, the right earlobe, and this is the left earlobe after 5 minutes of the injection. Same thing. This is an adipose tissue with lobular necrosis and microcyst formation. And this is a little detail, is another pathologist, because I would not to seduce the pathologist to see what I'm looking for. In the submental area, and 30 minutes post-injection, I found the same findings. And I made the third case just in the submental area and see what happened. In this case, I injected 2 cc in the submental areas. And after 90 minutes during my facelift, in which the total time is around 5 hours. So after 90 minutes, I decided to remove this neck tissue or double chin tissue. Same findings and no inflammation. This was one of my first cases in which you can notice the slimming effect, the delimitation of the jawline, the shadow below the jawline, and the slimming of the cheeks. This is another case. We can notice the improvement of the jawline and the improvement of the double chin also. And the same things, the same findings in the vector analysis, with all the vector lines going up and rear against the force vectors of the heavy tissue. The 2 previous cases was 4 sessions, but this was just 1 session. And you can notice the improvement or the changes. And the patient also notice the changes. That's why they are always present in the consultation appointment. This is a strange case in which I notice and I prove the improvement, but when you get a close-up to this area, in this patient, I inject just in the middle of the entire jaw and less massage, almost no massage. So in the area in which I injected, the fat removes, but not in the surrounding areas. So I have to make another 2 sessions in order to improve these remaining areas of fat tissues. This is another case. You can notice that the weight of this heavy tissue in the inferior jaw began to improve. It's magic? No, but it's a real improvement, and we don't have any plan B for this area. This is a double chin treatment and inferior jaw also. One of the findings that I notice in my daily practice is that when you inject the jaw, the double chin improves with no injecting. Pay attention with this patient. She is 25-year-old patient, and she asked me to make something in the BSHAT or fat pad, buccal fat pad improvement. He asked me to make a bichectomy, and I said, no, you are not a case for bichectomy and even for cell booster. You have a lack of projection in the chin, and you have a lack of definition in the posterior border of the mandible. So I decided to inject 4 cc's of filler, getting an improvement. Please, my colleagues and my dear friends, notice that not all the patients are qualified to inject Cellbooster Shape. First of all, we have to make a very good observation in the facial proportions and the bony structures, because it's not necessary to make any kind of removal of fat tissue. In this case, we added 4 cc's of hyaluronic acid, and to get the parallelism, I published a paper. You can find in the PubMed, it's open, You can Google by parallelism, and you can see the parallelogram, which is the main goal to get in all the patients. The gonion is very low, very far from the lobe, from the earlobe, and this is what you have to get. Like in this case, 16-year-old, and her mother, which is a patient of mine from many years ago, she said to me that her daughter is very worried about the shape of the face. So I decided to project the chin and also to remove the excess of fat tissue. I decided to make 6 cc's of product and 6 sessions of Cellbooster Shape. Every month, I inject 2 cc's of Cellbooster Shape, 2 cc's of HA filler, and 1 vial of Cellbooster Shape every month. You can see that the balance is much better in the post because of 2 reasons: the projection of the chin and the diminishing of the volume in the cheeks. This is not a problem of the inferior jaw, but this is a problem of the buccal pad and also for the superior jaw. So, what do we have so far? The main protagonist of this product is the L-carnitine, which the mission of the L-carnitine is introduce the fatty acid into the mitochondria to produce the burning of this fatty acid and transform it into the ATP energy. It needs this technique, this technology, which is the CHAC technology, in which is added the vitamin C and also the L-carnitine to the hyaluronic acid molecule, in which allows to use as a carrier and enter into the membrane cell. These are the mechanisms of action and the properties of every product, ingredients. But getting back to the main question is, all this mechanism of action takes time to get started, at least 1, 2, 3 days, I suppose. So why can I see the results immediately, and how is well demonstrated by biopsy just at 5 minutes after the procedure? In summary, and to end this presentation, I would like to make a summary of the protocol. First of all, you have to make a landmarking of the area in which you would like to treat. And then you have to enter, look at this, 5, 7 millimeters below the skin, and you can inject in Fanek technique, no matter if you use needle of cannula, the result will be the same. But with needle, we can leave probably a bruise or probably not. After the injection of 1.5 cc's, you have to massage gently in order to distribute all the product. And you can see immediately the diminishing of the volume and one side compared to the other is more flat. In the inferior jaw is the same thing. But one of the things, important things, is to treat the SWAT, not the DWAT. The SWAT, which is it was created for storage and for support. This is the fat tissue that you have to treat, not the underlying fat tissue just stuck to the dermis, because this is the DWAT, which with much more metabolism action. Massage. And voila, boom. Look one side compared to the other. This is the other side. It is amazing that when you treat one side and you put the mirror in front of the face of the patient and see, look at you, she noticed the result herself in the mirror in the very same moment that you are injecting. Look how it begins to diminish the volume. And it is supposed that you have 1.5 more cc's of volume because you are adding liquid. But the total volume is less. That is funny. Take care about the veins. Watch out this huge vein. You have to notice, you have to work with a lot of lights to see the veins and in order to avoid it. This is another patient entering with cannula. Is just one entry point instead of many or several entry points when you are using a needle. So with cannula is much more easier and less painful. The product, the injection of the product is not painful because the product is not painful itself, but the procedure could be a little bit painful. And this is for you to take a picture, to make a screenshot. And that's it. This is a little bit more than 1 year of experience and many cases treated. I would like to leave share. Am I right? Is that okay? Okay. I'm I'm watching the questions. Yeah, many malar mount. Okay. Shape in malar mount. Yes. I use the shape in malar mount combined with Morpheus because in the malar mount you have many things happening all together. One is the lid cheek junction is too exaggerated because of the edema in the SUF. The second one is the accumulation of lymphatics liquid in the malar mount. That is very genetic. Some people have a lot of malar mount and some don't. The other thing is that this lid skin is beginning to be weak. So you need to reduce the fat tissue in the soup to improve the lymphatic drainage and also to tight the skin in order to make a better contention. That's why I use the mix of these two things: Cellbooster Shape in the malar mount and also Morpheus or radio frequency to treat it. How much the last effect? Yes, this the lasting of the effect is around 6 months. I didn't have pictures in this presentation about the following up, but probably there are people coming after 4, 6, in even 8 months to make just one session of booster. What about enzymatic lipolytics? Yes. I didn't compare in the same patient the enzymatic lipolytes. But I can tell you that Dr. No, Anonymous. I can tell you that the lipolytics generally produce a lot of swelling and pain and redness, but nothing happens with this product. Another, does L-carnitine work enough without deoxycholate? Okay, deoxycholate, I think, could be the gold standard, but do you know the side effects of the deoxycholate about the swelling around 15 days? Even 15 days in the double chin, for instance, the redness, the bruising, the pain. That's why in my country, it didn't work, the deoxycholate, because patient didn't accept the follow-up. ¿Cuánto duran los cambios? Nerea Felipe Santamaría. ¿Cuánto duran los cambios? Same thing. How does it how much is the long lasting? It's around 6 to 8 months, and then you have to inject a booster, 1 or 2 sessions. How to combine Botox and shape in the same session? Easy, because Botox, you mean Botox in the neck and in the lower face. Botox is the last treatment that you have to use in the combined session, with fillers, with lipolytics, with cell booster, with anything you want. At the very last moment that patient is almost leaving your office, you have to inject the Botox. It's the last thing, but you can add and combine both products in the same session. When is the final result? Okay, this is a very good question, because the final result in many other treatments, you have to wait at least 2, 3 sessions to begin to see the results. But in this case, you make one session, the first session, and you appoint the next consultation and see what happens if the patient comes or not. And the patient is always coming, because at the very first session, she begin to notice the minimal result. And moreover, after the second session, they notice much better result after the second session. Each session, I began this trial injecting one session every week. And now it's every 2 weeks. It's the same thing. ¿Cada cuánto realiza las dosis múltiples? I didn't get it. Please, would you mind, Pablo Melonari, to repeat the question? I didn't get it, sorry. In the neck, after a session or 2, María Dolores Arias, after a session or 2 in the neck. No, if she is asking me if the skin is sagging. No, not at all, because the vitamin C helps all the fibroblasts to produce more collagen and to reinstall the collagen and reorganize the collagen. This is one of the missions of the vitamin C. Vitamin C has two missions. One is the diminishing of the fat by an indirect pathway. But on the other hand, they improve the architecture of the fibroblast. How to use Ahmed Gamal? Um, how to use cell booster shape for eye bags, dose, and techniques. Okay, if you mean the eye bags as a palpebral bags, which are surgical, I perform a blepharoplasty in one patient, and it remained a little bit just on one side, the external fat bag, inferior external fat bag. And I inject 3 sessions, and it diminished, but a little, not too much. So I do not recommend injecting in the fat bags, in the palpebral fat bags, Swiss cell booster. Not because of it's not safe, because it's safe, but not too evident the results. How many shape you can use in one session? 2 vials, but you can use. I heard about an Italian lady physician that she used 6 vials per session in the tights, not in the face, but in the tights. Where is the point of injection of young girls' round face? Okay, the proposal for young girls' round face is to angulate the face, to narrow the face. So you have to leave all the zygomatic area good, and the border, the mandibular border, also improved. So you have to diminish all the cheek, not the cheekbone, the cheek, the mid cheek. This is the main goal. And also you can add some filler to produce the narrowing face. ¿Cuánto tiempo dura el resultado estético, por ejemplo, al diluir el gel al terminar el protocolo? How long is the result, the aesthetic result, for instance, in diluting the gel and when you finally in the protocol? The result, the aesthetic result, the lasting of the result is around 6 to 8 months, as I said before. I don't know what you mean. Probably is this, which is the maximum dosage of shape, up to 6 vials in one session in the tights, in the body, not in the face. And around the eyes, do you prefer surgery or another thing? Okay, around the eyes, if you mean about the malar mount, no, not surgery at all, definitely not. Even if you have festoon, probably you can make some sort of incision to remove the festoon, but the malar mount is a combination of treatments. The cell booster shape and the radio frequency with micro needling. Good morning, Doc. I would like to ask you if I use it in body overall in tights. Yes, of course. But the amount is the problem, the amount and the cost of each session. This lady, this physician of Sicily, Italy, he has a very good results treating but 6 vials per session, 3 and 3. In double chin, you use cannula or needle. It's the same thing, but you have to know this one thing, Pablo Melonari. you have two kinds of fat tissue in the double chin. In the double chin, you have the superficial fat tissue, which is due to remove by Cellbooster Shape, and you have the interdigastrical muscle, which is very deep fat tissue. This is not an indication for Cellbooster Shape. You have to remove just the layer 2. The layer 2 is the superficial fat tissue. But you can use cannula or needle, whatever you want. Are the session intervals always 1 month for all transactions? No, no, no. I began Ersin Ataman. I began to use every week because I'm too anxious and I am a plastic surgeon. I would like to see the wow results almost immediately, like boobs, for instance. Uh, so in this case, I used the same philosophy and I inject every single week. And the results was very good and a little bit faster than every 2 weeks. Last for 6 months with only one session. To see, no, no. You have to keep all the sessions, at least 3 to 4. This is the average of the session that I use and also Pier Paolo Rovati used. 3 to 4 sessions. And after 3 to 4 sessions, the clinical result, they are visible results. Under eye fat, I explained it before, Mariam Ashrafi. Anonymous, thank you for the presentation. As an anesthesiologist, it was my first time witnessing something like this. Yeah, me too. Seeing live tissue samples taken during surgery and hearing the results in real time was truly fascinating. It was a very interesting and valuable session. Thank you again. Yeah, for me too, because I couldn't explain myself. That's why I decided to make to the biopsy and see what happened at the real and the real world and the histologic perspective. Mariela Nazar, hi Raul, excellent presentation, congratulations. Do you use an eye bags? Same thing. Eye bags is a very it's very difficult to treat by itself with cell booster shape. You have to add some kind of radio frequency needling like Morpheus. Anonymous. I ask una PC para una. They have a patient to make in the tights. This physician already done in face, and it was a good. He have had a good result. So congratulations. Yeah, you can use it in tights, but you have to spend a lot of vials, 6 vial each session. Anonymous, how many vials do you apply to your face or chin? To my face, I think just not chin, the double chin. In my case, I could use 1 vial, half and half, 1.5, 1.5. Shape could be used for under eye fat. Yes, the same thing, combined with radio frequency. It is also affected in lipoma. Okay, very good question, Monica Fuchs. Lipoma. I have a friend of mine, a colleague of mine, who have had a patient with a lipoma around 3 centimeters of diameter, and she decided to, first of all, to inject cell booster shade and see what happened. It reduced more or less at half. And then she decided to remove it by smaller incision because the size of the lipoma is less. So this is one advantage. But when she decided to remove it, she injected on the table after remove the lipoma. She injected in the table, and suddenly the shape and the surface of the lipoma changed. It was more smooth. It was very strange. What is the injection site for young girls who want to slim their faces? Okay, the cheeks. You have to make more angle face. And the angle face is supported by the zygomatic area and for the jawline area. So you have to remove all the rest in order to produce smooth, slimmer face. Anonymous, in case of using with Morpheus, first you have to apply Morpheus and then Cellbooster Shape, whatever you want. But after, if I have to make it in the same session, first of all, there's the Morpheus and then Cellbooster Shape, just when she is going to go out from my office. Nerea Felipe Santamaria, and when you make a new session 6 months later, how it lasts? Okay, we didn't we didn't know so much about the follow-up of this treatment because I have this product since 1 year. So I cannot explain and I cannot answer because at least I have to have at least 2 years at least. The back of the SUF, Roxana Montaña Perez. Same thing I explained before. Yes, you can, but adding the radio frequency. For body, can you combine the oxycolator and shape at the same time? If the patient tolerates the swelling and the pain, yeah, you can use it because you can have the conscious that the oxycolate is very aggressive, but on the other hand, you have just an amino acid, which is L-carnitine, and vitamin C, so nothing happened. Mariela Reale, if you want to make treatment with biostimulators in which is the order of using in the same session, yes, you can use it. First of all, every other product, and then cell booster shape in the same session. We see result after one session, after 2 weeks. Yes, Saed Jari. Yes, me too. And the patient also. That's why the patient goes to the next appointment. And they are very neat to the appointment, one about after the other. How much cc do I need for the double chin, for example? Okay, Pier Paolo Robati taught me that it's just 1 cc. I think it's 2 cc per session in the double chin. Depends on the size of the amount of the fat tissue in the double chin. It is true that cell booster shape can work for acne. I really don't know. Not the shape, at least. I don't know if cell booster lift or glow. I really don't know. Is it happen inflammation after necrosis due to necrosis after disinfection? This is funny because Bangaderi, because in the biopsies we didn't find the inflammatory cells. This is amazing and funny and strange, also strange. Pablo Meronari is okay. Avan Gaderi, how much maximum could we use in each session? Depends of the area. If you are treating the face, 1 or 2 vials. In some patients, I use 2 vials per session because it's a lot of amount of fat tissue that I need to remove. So I use 2 vials per session in some patients. It is safe to an autoimmune disease as the product is formed by an amino acid and a vitamin C. Nothing happened with this with the autoimmune disease. Mariam Ashrafi. Anonymous. Can we use shape for nasolabial more than 2 vials in one session? Not necessary. At the most, must be 1 vial, half and half, and that's it. not necessary, much more. Shagan Abdul Mayed, what is the maximum number of cell booster shape vials that can be safely used in one session for areas such as an abdominal fat reduction? As I said before, up to 6 vials per session, but depending on the amount of the abdominal fat reduction. For instance, if you have just the infraumbilical area, the target to be removed, and you don't have so much, you can use 3 vials per session. Mariela Reale, if you would like to make also biostimulator treatment, in which order? In the same session? Yeah, you can use it, but first the biostimulation, and then at the very last moment, the Cellbooster Shape. Because you have to notice one thing: the biostimulator, you never have to use in the isolabial fat pad and even in the jawline, in the jaw. No, the superior, and neither the superior nor the inferior jaw fat pad. So all this um, uh, croissant area, all this croissant area is not allowed to use biostimulator. So you use biostimulator in here, and you can add the cell booster shape in this area. So now you prefer shape over an enzymatic lipolytic, same result with none of the, thanks, doctor. I suppose that with lipolytic, probably you get a little bit more effect, but the cost and benefit, this balance, I don't deal with it. I prefer to, me and the patient prefer no painful and no swelling and no bruising. Mariela Lucero, thank you, master. Nerea Felipe Santa Marina, how much do you pay for a session for one violet? It's not expensive, so you can charge double of the cost, or in my case, the triple of the cost, because I have a huge clinic with 10 employees with a lot of spending money every month. So in my case, every single product I multiply for 3, but you can multiply for 2. Tonia Begue, how many vials do you use at the first session? 1 or 2 vials in the face? Mostly 1. Marisa Torres, hola, hello, thank you very much. Which is the doses for session in fat pads? In Joe, in malar bags, I use 1 to 1.5, mostly just 1 cc, because it's not more needed, because the swelling, the immediate swelling, because you are filling with liquid, all this area is amazing. So after this, you have to massage and massage and massage against the bone. And the jaw is 1.5, yeah, 1.5, half vial each side. Mohsen Mahmoudi, for buccal pad, you advise inject via the mouth or percutaneous? Very good question. You probably are a plastic surgeon. No, I am percutaneous, but I am trying to reach. You have to take to touch the teeth, and between the upper and the lower teeth, this is the bichat or buccal pad. You have to enter very perpendicular, and to get after all the entire length of the needle, you have to enter to use the entire length of the needle, and then you have to inject. Thank you for the question. Mariam Ashrafi, it is okay for genital fat? Really don't know, but you can try. I never use it. Anonymous, Can we shape to remove cellulite? Yes, it was originally created for cellulite. This is, I think, a discovery from Pier Paolo Robati because it is amazing. It was constructed for cellulite treatment. Sandra Quanti Dioi. En un lipedema, in a lipedem, could you use? Yes, it produces a lot of lymphatic drainage. So I think it is a chronic treatment, but you can use it because lipedema is a chronic situation. Elam Sabet, thanks a lot. What is the correct depth in injection double chin? The correct is the same thing that in jaw and in nasolabial is around 5 to 7 millimeters below the skin. Noemi Cardoso, good morning. Among LNC and shape, okay, first LNC and then shape, but in different areas. So they will not fight against each other. Can you do treat, lift, and shape at the same session? Yes, of course, because you can treat in the dermis with lift and shape. Yeah, I use it many times together in the same session. Noemi Cardoso is able to make an ultrasound post shape in cheeks. Ultrasound, yeah, you can use it to see what happened, but I don't think that you can see the microcyst because they are microcysts. It's not a huge cyst. You mostly will see the liquid probably. I don't know if you can find something new in the ecography. Anonymous, which is the amount that you can use cell booster shape in nasolabial fold? 1 to 1.5 cc each side. Sandra Quanti Dioi. Post-op cares at the session massage called nothing. Nothing. You have to massage immediately after the injection and then done. Nothing. She can make exercise at the same day. If you have no bruising, you can take some. It's not recommendable, but you can do it. Mark Lin, is it means the lipocell going with apoptosis? No, it's not apoptosis, it's lipolytic. That's why I got amazed with the results in the biopsy. Is lipolytic. This is what I cannot understand so far, honestly, but it's amazing. Shua Si Xuan Sinde. Can the solution be stored if unable to finish the entire vial in a single session? Yes. As every kind of vial, you have to be very careful with the contamination. So that's why when I don't have to use all the entire vial, I put antiseptic in the rubber and then I enter with the needle, I extract all the product, and I store it in the fridge. Anonymous, dog for concave eyes, do you use cell booster lift or shape first? Concave eyes. I think you are meaning about the wrinkles that it often you can find in the concave eyes. Cell booster lift. But if I have concave eyes, it's not necessary to use shape. I'm sorry, I didn't get probably the question. Mehdi Hayati, thank you for your excellent presentation. Thank you, Mehdi. I would like to ask whether you have experience managing patients who still have residual fat following liposuction. Yes, I treat one patient in the infraumbilical part on one side. After abdominoplasty, I perform a liposuction and also abdominoplasty. She, the result was very good, but as she's thin, she has a remaining fat amount, a remaining but little fat amount in the left side compared to the right side. It was necessary 2 sessions to equal both sides. Shahagan Abdul Mayed. Can Cellbooster Shape be combined with radius? Yes, but in different areas you can combine. But always avoid the croissant. This area and this area. You can treat with biostimulator mostly with radius, which is very strong and very heavy, as well with the harmonica. Of course, the same thing. From the premacetary ligament, which is false ligament, backwards, 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 backwards. Never in this area. Anonymous thread leaves, we look for inflammation, but we do shape. It's anti-inflammatory. Does it will affect the result of thread lift? I really don't know, because in my country, thread lift, the threads are beginning to disappear because the lack of result, the post-op, the different effects, the bumps and lumps. So in the community, in my community in Argentina, and I think in all Latam, they are beginning to leave this treatment. Deborah Ferrini, congratulations, dog. Excellent, my experience from Argentina. Deborah and Romina, thank you, Deborah. Patricia Corvera, for fat bags in under eyes. Again, Patricia, I explained it many times before. 1 cc and the malar mount. But if you have inside in the palpebral fat packs, I don't recommend it, not because of the safety reasons, because it's safe, but because of the results. There are not too much results after sessions. I prefer to remove it by surgery. When you will see the results, Anonymous, after the first session, you can begin, you as a physician and the patient also begin to see the results. But after the second session, you notice the difference, you and your patient. Noemi Cardoso, shape could replace the subcision, not at all. Or first subcision, then shape doses. No, first, please make the subcision, make the hard thing first, and then leave the shape to treat and to touch up all the surface. When do you use Cellbooster Lift? When I have to improve the papillar and reticular fibroblasts. This is, Nerea, the main indication of Cellbooster Lift. When I need to improve the dermis, when I need to give more stability at the dermis in order to avoid some fine lines or fine wrinkles. Sayed Yari, do you have experience for removing, injecting, and autologous fat? No, 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 no. It was not, I have no experience in this, but it will be very good because it's another kind of fat that you extract for the inner part of the knees, for instance, or inner part of the legs. But it could be very interesting to have experience with that, but I don't have. Claudia Duarte, excellent presentation. You had this. Thank you. And Anonymous, can you combine 3 variants of Cellbooster at the same time? Yes, of course. Yeah, you can use it combined at the same time, at the same session. Okay. Lot of questions. Lot of questions, and I really thank you for all the questions, for all the interest. I'm very pleased to be here. and to share my experience, because I'm not teaching anyone and anything. I'm just sharing experiences. That's why I'm very glad to stay with you today until this time. So for me, it was a real good pleasure to be with you. Nina, I think we are okay, isn't it?
Yeah, I think we all good.
Okay. Well, thank you. I will disconnect myself, and thank you to all the people. Bye.